Good evening and thanks for joining us. As we begin another week enduring this pandemic, there are some promising signs here in Canada. It does appear physical distancing is slowing the spread. Canadian hospitals have not been overwhelmed with cases like Northern Italy and New York City, but we also know many Canadians are dying in their beds in long-term care facilities where this virus keeps spreading at an alarming rate. Here are the official numbers. At least 780 people in Canada have now died of COVID-19. Nearly half of those are linked to long-term care facilities, and that number is expected to rise. Often those people are dying alone. They've been isolated in their rooms, and families are banned from visiting. And across this country, families are grieving at a distance tonight. Staff at care homes are not well paid and often work part-time and in multiple facilities. That increases the risk of spreading the virus. BC and Alberta have banned that practice, but other provinces have not. In Quebec, changes are now being made after 31 residents in one private care home died in less than a month. Quebec's premier says every long-term care home, public and private, will now be inspected. Mike Armstrong has our top story tonight.
Patricia DiBiase says her first reaction to the revelations coming out of the Herron Seniors residence was nausea. Her 97-year-old mother is inside and suffers from dementia. As funeral home trucks continue to leave the residence, DiBiase and her husband say getting information from anyone has been difficult, and what they do get, they don't trust.
We've been, in our estimation, lied to this whole time through.
The finger-pointing began as soon as the bodies started being carried out of the residence. The local health authority says it put the facility under trusteeship March 29th and blames management for the crisis. Global News has obtained emails between the health authority and management. It does show the owners of the facility were asking for help. Much of the staff was staying home, quarantined because they'd been in contact with residents with COVID-19. The Premier says that wasn't enough of a red flag.
It's very nice to say I need more workers, but to say, hey, I'm at 31 deaths in a couple of weeks, that's something very urgent.
Now, the owners of the residence say they tried everything, including bonuses, to keep staff on the job.
But the government is telling them as soon as you come in contact with COVID-19 that you can't come on the floor, you have to stay in your house and isolate for 14 days.
Now, the Herron residence has been criticized in the past. A coroner's report into a choking death in 2017 raised questions about the training of staff, and the owners were sued for wrongful dismissal by a former manager in 2018 and lost. When he was fired, the manager was told he hadn't done enough to increase occupancy and cut costs.
The number of deaths, unfortunately.
Now, Ottawa has announced guidelines to help stop the spread of COVID-19. Things like ensuring staff only works at one facility and doesn't spread the virus. But so far, only Alberta and BC are doing that. One of the reasons? It can mean a big cut to staffing, already the biggest challenge. Wages in the industry are too low, so many people have to work part-time in multiple facilities.
The minute you restrict where they work, as you should, unless you do something more about it, then you cut your workforce by about, 25% off the top.
Quebec is looking at boosting pay in some residences. Right now, the Premier says there's a vicious circle where an industry that already has too few people is tougher and tougher and less attractive as a job. Mike Armstrong, Global News, Montreal.
Any facility where people are confined in close quarters is at risk. And now a refugee shelter in downtown Toronto is reporting an outbreak. 4 cases of COVID-19 have been confirmed at the Willowdale Welcome Centre. Test results on a number of other residents are pending. The facility houses more than 200 refugee claimants, and physical distancing has been difficult.
The new series that goes inside the COVID-19 pandemic. From the front lines.
We're still in a very critical stage of Canada's COVID-19 epidemic.
To the everyday heroes helping us cope with the unprecedented change.
We want to help because there's a desperate need.
We shouldn't fend for ourselves. We have to all come together and help each other out.
Coronavirus, the new reality. A Global News special, Sundays at 7 on Global.